Hello, my name is Dr. James H. Lambert, and I'd like to welcome you to Ligament Laxity Analysis. We'd like to show you just how easy it is to test for ligament injury in both the cervical and lumbar spine. But first, it doesn't really matter what type of doctor you are. If you're a neurologist, an orthopedist, a chiropractor, or a physiatrist, if you deal with spinal injury patients brought on by trauma, doesn't matter what the trauma is. If those patients come to your office because of a motor vehicle accident, from a work-related injury, or a sports injury, those injuries or lesions generally fall into three categories, and we've all seen them. First category, fracture. Luckily, you're only found 2-3% of the time. Best seen, usually seen initially on X-ray, and then picked up once the patient is referred out for a CT. The second category are disc injuries. Disc injuries are generally found about 30-35% of the time and best visualized with an MRI. Third category, ligament injuries. Generally, these injuries are 95% of the time with these patients. These patients come in. They're best picked. These injuries are best evaluated with stress films and then with computerized radiographic mensuration analysis on those films. Very, very simple process, and we'll get into that in a little bit, and you'll see how easy it is here. I think you'll find is that these patients, these spinal trauma patients, I think their treatment, if they're not treated as they should, a lot of times these acute injuries end up being the chronic back and neck patients that we see in the office years later. It's been shown that these acute injuries are probably the precipitating factor of the epidemic that we see as chronic back and neck pain. It's the number one cause of pain and disability worldwide. We have to take these injuries more serious. We have to take them. My research shows that maybe 10% of the population, 10% of the physicians out there now are using computerized radiographic mensuration analysis or ligament laxity analysis to evaluate these injuries. All these patients need and deserve to be evaluated and have an accurate diagnosis. Without an accurate diagnosis, we all know that the most appropriate treatment may not be provided. So, let me ask you, what are you doing now to evaluate soft tissue injuries in the cervical and lumbar spine? If you're not using computerized radiographic mensuration analysis, why not? It's that simple, and our goal is to show you and make it as simple and easy as possible on you. You take the films or you refer the patient out for the films. It doesn't matter. We'll obtain the films, either digital or the films themselves. We'll run it through our software. You'll have a report back in your hands within 48 or 72 hours. You'll know if the patient has significant ligament injury. You'll be able to have an accurate diagnosis. You'll be able to provide the most effective treatment possible by having that accurate diagnosis. So I want to keep this relatively short, but I just wanted to welcome you to the site. If you have any questions, please call us. You have our contact information now. We look forward to working with you. All right? Take care.